Welcome to Recovery Reach by Recovery.com, where we talk about the business of recovery, because the more people you reach, the more people you can help. Today's guest is Dillon McClernon from ERP Health. We're diving into how measurement-based care isn't just a clinical tool, it's a growth engine. You'll learn how tracking outcomes can fuel your marketing, give you leverage with payers, and help you specialize and stand out in a crowded market. Let's get into it. There's so many different ways that we could enter this conversation about measurement-based care.
Yep.
I think the first way we should do it, though, is probably just some ground setting, some level setting. There are so many like X-based care words out there.
Yeah.
Value-based care,
Yep.
evidence-based care, outcomes-based care, measurement-based care. So let's just figure out, what does measurement-based care mean in the context that we're going to talk about?
It just based on the pretext that you just gave, right? It is a very complex question, right? Measurement-based care in its most simplistic definition means taking data that you're collecting, and that can be in a number of different ways, right? In the ways that I traditionally work, right? Patient-reported outcomes data, biometrics, though, a number of different family-based reviews and assessment data, right? Whatever that is, and informing the actual treatment plan and the treatment model for patients based on the measurements that you're collecting over time, right? And so it's gotten convoluted because there is no one size fits all. There's no standard, if you will, in the industry as far as what exactly you need to or should collect in order to inform the most effective modality of care. Because care, especially in the behavioral healthcare space, is super nuanced to the person, right? Mm-hmm. And so what that to me means is that, yeah, there's confusion, but there's also great opportunity, right? Because if you are equipped, right, in order to track the things that are most important to the patients that you're serving, mm-hmm. then you don't need a model necessarily. You just need a way in which to track that information and to create a feedback loop, mm-hmm. in order to make your treatment more informed by the data that you're collecting.
Yeah.
Right?
Okay. So don't get caught up in the words or the terminology. At its core, this is a pretty simple sounding thing. And I'm sure implementing it, there's varying levels of complexity. But at its core, collecting data about people that creates a feedback loop during care, mm-hmm. in order to determine, this is what week 1 was, how should we adapt this for week 2 and for week 3?
Exactly.
When we get into the right area.
It really is or can be as simplistic as that, yeah. Right? In the context of a different industry or a different, vertical, right? A salesperson not being able to see how many calls that person made in a given week versus how many conversions they've had versus the total amount of sales that they've generated, right? Mm-hmm. It's legitimately kind of synonymous with flying blind. And in the business of saving lives, right? In the business of understanding what patients need, when they need them, when they need it, right? Mm-hmm. The difference can be that simple, at least to begin with, right? Mm-hmm. Introducing and implementing a systematic process by which data is being used, mm-hmm. across the board, right? In order to inform not just the individual treatment of a patient, right? But the organizational strategy that you do, right?
Yeah.
We were just having a conversation before we walked in here about specialization. So behavioral healthcare, as a rule, has grown exponentially, especially in the last 15 to 20 years, right? And there's a number of different reasons for that. But most definitely, it alludes to the continuously growing demand, right? I talk a lot about I'll call them the tailwinds for the work that we're doing. And I'll put it this way. As demand continues to increase, because stigma continues to decrease, consumer knowledge, wherewithal, right, is increasing with it, right? Increasing with demand. As the number of facilities, the number of treatment providers continues to increase to accommodate that increasing demand. Mm-hmm. What we're not seeing currently is a sophistication in the specialization of care, right? The way that we would in physical care, biological care. And so what we're talking about a lot now is by, again, introducing and implementing an outcomes-based approach. Not only are you able to provide better care because you're able to understand where the patient is at any given point in time and maybe course correct the treatment plan. I'm not a clinician, right? I'm not pretending to be one, but simply stated, that's the obvious benefit, I think, from within the clinical domain. But outside of that, right, understanding organizationally what you're doing well can mean enabling you to focus on what you're doing really well, right? There's too many options for people to discern between right now. And unfortunately, the space has gotten a bad rap, right? Despite the fact that by and large, and I mean by and large, right, providers are doing God's work, man. I mean, the clinicians care deeply. The owners, by and large, care deeply. But there's little ways right now because of the lack of data-informed treatment, and that includes both clinical and non-clinical, strategic, whatever else. There's little data to support organizational change to focus instead of on treating everybody, on treating a subset of patients who you could treat really well.
Measurement-based care and looking at the outcomes serves so many purposes beyond its main purpose, which is the patient experience and treating the patient. And we're going to get into all of these, and specialization is one of the takeaways from this that's hyper relevant. Before we get into that, though, let's just again do some level setting with measurements. To me, when I hear you talk about this, it sounds very obvious. It sounds like, what gets measured gets managed, right? But it's my belief that the industry as a whole has been slow to adopt this type of thing. And I'm just curious, why do you think that is?
This is one of those situations where I will repeat that I am not a clinician, and that I also admire, and I mean that, the work that clinicians do. Like any other industry, I do think that there is a traditional way of doing things, right? Technology is not traditionally, or has not traditionally been a part of that process, right? Because of the volume associated with their work, how many people they have to see, how much paperwork they have to fill out, the sheer amount of time it takes. Without technology, it's been extremely difficult to map the evolution of a patient's progress, whether it's on pen and paper or in EMR or whatever it is, right? And then have accessibility to that information in such a way that it doesn't burden the clinician, right? And then secondarily to that point, a new piece of technology to a clinician is not always welcome news, right? It's not. To learn something seems very tedious. We've all been through tech implementations, right? At one point in our careers or another. And by and large, they're not very fun, right? I don't even consider myself to be a super old person, but I don't like learning new shit. I think there's a little bit of resistance as it comes to doing things differently, as there is everywhere. In every industry, in every role, in every industry, right? We've seen ASAM adjust their guidance on measurement-based care. We have several other regulatory bodies who very plainly call out the need for the inundation of measurement-based care, right? But without a mandate, there's not enough incentive. There's not enough external motivation to overhaul the way things have always been.
Yeah, that makes sense. I'm going to read something that you recently posted on LinkedIn because I think it sets up the rest of this conversation extremely well. So if you guys don't follow Dillon, I encourage you to. He's got some great content out there. And here's how he puts it. He says, tracking outcomes is great, but are you leveraging them for real growth? Outcomes tracking isn't just a compliance tool, it's a growth engine. And here's really what I want to start talking about. So then he puts all the reasons it is a growth engine. Secure new referral relationships by proving clinical success, boost marketing performance with measurable results, increase length of stay through data-driven care improvements, and renegotiate better rates by showing payers real long-term progress. So kind of 4 buckets here about how outcomes measurement can benefit beyond just the level of care provided to a patient. I really want to get into them, starting with kind of marketing and how measurement-based care can fuel your marketing and set you up to tell stories about the work you are doing to have real impact and maybe nudge somebody along that journey of theirs to say, I'm ready to take the next step with somebody. So in your mind, how is this a fantastic marketing tool that's probably getting slept on?
From a marketing perspective, if you talk to any true marketer in this space, they will tell you, build a great product. And as a treatment provider, your product is your clinical product, right? You build a great product and you won't need as much marketing, right? What I found out was that, we needed to set ourselves apart in a way that was not being leveraged by a large majority of the other treatment providers that we were at least technically competing against, right? And, tried to capitalize on that opportunity and found that there was no easy way to do so, right? And so through a combination, depending on how large a facility is, right? They might have, or a program is, they might have 10 facilities across the country, right? Everybody might be tracking different information in different ways on different systems, sometimes pen and paper, right? And second of all, is probably not all that verifiable in nature, right? And so first step was, let's figure out a way to enable this, right? Through technology in order to do it. And then secondarily, how are we going to stand out by talking about the things that we're doing really well? So there's a really important caveat here, because I hear on calls all the time from very candid CEOs that I don't know if I want to know about some of our outcomes, right? And the point is, clinicians by and large are doing a fantastic job. And in situations where improvement is possible, you can legitimately, by having that data at your hands, make improvements to offset some of those shortcomings potentially, right? The things that are most important to you, and more importantly to the patients that you're serving and the families that are seeking you out for treatment, right? So whether it is depression and anxiety, right? Whether it is who's completing your treatment, because that says a lot. How are patients reacting to the treatment that they're receiving in real time? All of these things are extremely customizable as long as you have a structure by which to do so. And if you have a consolidated system in which to collect that data and report from it, then it not only becomes a source of marketing collateral, right? But it becomes a narrative for the entire organization, right? It becomes a driving force between, the way that you're talking, obviously, to external third parties in the consumer side of things, right? It becomes the leading point, if you will, in business development conversations when you're going out trying to secure referent relationships, right? You're talking not just about how nice your facility is and, where you went on vacation last week in some cases, but talking about the patients that referent partner is serving and how you treat that demographic of patient, right?
Could you kind of paint a picture for me? So talking just about marketing collateral, let's say there's a facility out there who does a really good job tracking these outcomes. What would you expect to see on their website as someone who is looking for help in that moment? What does having these outcomes at the ready kind of unlock for marketing collateral?
Absolutely. So, from a website perspective, right? I mean, there's facilities, there's partners of ours that have it above the fold on the website, right?
What do you mean by that?
One of the very first things that a patient or their family member will see when they enter the site, sometimes, they search for men's, women's, whatever that initial criteria that you draw down the line. The first thing you will see is, how much did the depression in that population decrease during the time of treatment? Anxiety, right? How many completed treatment? How many relapsed, within 90 days post-treatment?
Mm-hmm.
There's a number of different, like I said, there's a number of different criteria that you can include in that. But right next to whatever the tagline is that you have can be blurbs about the efficacy of your treatment.
Mm-hmm.
And if you're doing that right now, you are in the 1% of the 1%, right? But as we are searching for ways across the industry to differentiate ourselves across our competition, I can't help feeling like a salesman when I say it, but it is the last, horizon, if you will.
Yeah.
It's the untapped source for us to drive our own value differentiation.
Let's say it again. Why is that a differentiator?
It's hard, right? It's hard to be so ingrained in this process and then think back to a mother of a child who is struggling with addiction, right? Who has zero idea about what they're looking for, right? Or be a 35 or 40-year-old man who has never sought treatment before and is really, really scared about the process that they're about to undergo. They enter into a sea of possibilities, right? And as you go one by one, we used to do an exercise, right? Where we would basically put a collage together of the home pages of 20 or so different providers. Take out any brand, take out color, color palettes, whatever it might be, and say, pick which one's ours. Tell me which one's ours, right?
Yeah.
And you can't do it, right? Because the standard of care is such that everybody is saying what they need to say.
Mm-hmm.
And so how then does a scared mother of a child who's struggling, or a 35 or 45-year-old man who doesn't know anything about what we're talking about, choose what's best for them? Because they're at oftentimes their lowest point, right?
Yeah. That's a really good exercise to do, is just to look at all of the homepages of other facilities in your area and just see, do I stand out,
Right.
or am I just a sea of same?
Right.
And it sounds like outcomes, because for various reasons, folks aren't focusing on them as much as they could be. By just including something like that, you are setting yourself apart from other folks.
And it's the tip of the iceberg, right? So to get back to our earlier point about specialization, as the industry has evolved again, and the need continues to rise, right? We have opioids, we have alcohol, we have mental health primary, we have ADHD. I mean, you name it, right? There is a number of different things that someone could be seeking treatment for. And the treatment modalities associated with those diagnoses types are sometimes at their core a little bit similar, but there's also great differences between them, right? And so while we have evolved to meet the needs of a diverse customer base, we've also evolved to try to be able to treat all of those things, right? And I'm not saying that a lot of these places aren't doing a very good job of doing that.
Mm-hmm.
But again, if you can't stand out from a group and you don't have the money to buy the first place on Google,
Mm-hmm.
then how are you going to be found when someone is looking for treatment? And the answer to that question in my mind is by specializing.
Yeah, let's get into it. What do you mean by specializing?
It's understanding, first and foremost, through a systematic approach to measurement-based care, and obviously a mission, right? A vision for who you want to be and where you want to be.
Yeah.
Understanding who you want to treat, who you treat well, what you treat well, and, if I may be so bold, not being too afraid to own that segment, right? Someone calls in opioid use disorder. We treat primarily, 35 to 50, year alcohol use disorder. I have a great referring partner who specializes in opioid use disorder.
Mm-hmm.
Not being too afraid to turn away patients because what you do is specialized and nuanced to treat a specific subset of patients, right? And if we can get down to the ability to speak to the people who need us most, I think the results will speak for themselves.
Yeah. There's a great phrase in marketing called there's riches in niches.
Yeah.
And it's true. I feel like folks move super general because there's a big market. We can help a lot more people.
Yeah.
But as everyone starts doing that, and as people who are seeking treatment are usually more well researched,
Totally.
they're looking at a lot of different places. If everyone's a generalist, no one is going to stand out or be the right fit for that person because they're ultimately looking for, is this for me?
Exactly.
And if they just see standard boilerplate, the answer is no. Measurement-based care and being able to track all of these, you're actually suggesting for marketers or for, the business responsible folks at facilities, use that to figure out who are we treating the best, who's having the most success at our program.
Yeah.
And then have the courage to say, maybe we start diverting resources for that particular person.
Absolutely. I mean, at the base of it, right? Most providers aren't brand new organizations. They're well on their way, right? Understanding is the first step, right? Awareness is the first step. And then what do you do with that data? Again, we come back to how do you make decisions without data? All of the benefits that come with that really rest in the ability to have conversations that are based in an understanding and an awareness of what's actually happening.
Yeah.
Right.
I love it. This is great. We had briefly touched on, business development, right? So we just kind of talked about marketing collateral. Now BD is going out into the field.
Yep.
Let's talk about kind of what their typical role might be as they're going to people who could refer folks to treatment and how this helps them as well.
Most often, again, simplistically, your facility enters into either formal or informal referring contracts with other facilities so that, if a patient comes in and they have an insurance that they don't accept, they have a relationship with a facility that does accept it, right? And that's one thing. All of the rest, or at least a majority of the rest, come from referring providers of other services. So whether it's an ER or a therapist or, a doctor of any kind, you're building those relationships in the hopes that when someone does have a episode or a need arises, that they will think of you and they will send that patient to you for care. But how much more meaningful can those conversations become when you're able to bring a legitimate and third-party verified data set that spells out exactly what your treatment efficacy has been over the prior year? If you can say with definitiveness that my facility treats young adults to, these levels of efficacy, that my treatment facility, is able to treat middle-aged women with these levels of efficacy, what is that person or people going to think, when they have to make a decision about a person that they have a relationship with in some way, shape, or form? And they have to be the person who decides who's going to help get that person better, who's going to help that person recover, right? This next evolution that we're moving into, and I would call it, in behavior, we're a little late, but the age of information in the behavioral healthcare space.
We're there now.
We're there, baby. We're there, man. And it's like, we're just on the precipice of this really, really cool tectonic shift in the way that the world at large, right? Views this industry, views this disease. And we need to do a better job industry wide of being transparent about how we're treating patients.
Yeah, right. Doctors, professional referrers, these folks are continually educating themselves on the industry. It's part of their job. They are reading, medical journals. They would be so interested in seeing third-party validated outcomes data from centers. So it's like the cherry on top of a great relationship.
Right.
You're coming to them and you're building a relationship over time, and all of a sudden you add, and here's a booklet full of outcomes data. Aren't you happy that this relationship exists?
Yeah.
You know, like,
Absolutely.
you've been doing so good by your patients for sending them to us because look at what we're doing for them. Like, that's just such a nice, bow on top of everything for this relationship you developed over the last few years.
And as we talk about, further use cases here, whether you have an investor at your provider, right? Whether you have a PE group that's invested, whether you're planning for an exit, I'll put it this way, right? Even if you don't have the results that you want to have, you have the results and you also have a plan on how to make those results better the following year. Mm-hmm. And I understand I'm a person in recovery, right? Mm-hmm. I came into this looking to elevate patient care. My actual intuition, from a business perspective, from a human perspective, right, is that this can do nothing but improve patient care, right? Because the more that organizationally speaking, we are all singing to the same sheet music, right? That we're all super aware of who we are, what we do, how well we're doing it, then there is a consensus, right? Yeah. You're building a consensus, an organizational consensus around what needs to happen to get to where we need to be.
Yeah, let's get into this now. Like, let's talk about payers because there's a marketing element to this. There's the BD element to this. Say nothing about the patient, right? Again, that's first and foremost what this is really impacting. But then there's the payers.
Yeah.
And I think you've got some interesting stories of how collecting this type of data can help you improve your business because, like you said, no money, no mission. Mm-hmm. So let's kind of get into that. Like, how are payers looking at this data or starting to look at this data?
So there's been this push, obviously, to go from what we are currently dealing with, which is a fee-for-service model, right? You come in and get treatment, you get reimbursed a specific amount depending upon the insurance that you have, and you go on your way, right? Yeah. Into a value-based care agreement, which is, essentially a risk-sharing agreement. If you get them better, we'll pay you even more. But if you don't, buck up. And so there's been this kind of long-winded conversation to move closer to this goal of value-based care. Yeah. And we're just not there yet, right? Yeah. But that does not mean that on an individual basis, right, you cannot make yourself more attractive by doing the things that value-based care implies, right? Value-based care contracting implies, right? Measurement-based care has been shown to decrease AMAs, which is leaving against medical advice, by upwards of 40%. That's a legitimate study that was conducted, right? So what we talked about at the beginning of this conversation, taking data and informing treatment with that data makes patients leave against medical advice up to 40% less often.
Yeah.
The simple implementation of feedback, measurement-informed care, to say nothing of the ability in real time, if you're collecting data in a streamlined way, to actually extend for additional length of stay.
Yeah.
By having the data to support the fact that they're not ready to leave, you are exponentially more likely to get approved for those additional days.
Yeah.
So that's that very acute clinical setting, right? And the opportunities there that we've been able to, enable with our partners has been fairly significant in their own right, right? What are you doing once you have 12 months worth of outcomes data, right?
Yeah.
What's the story that you're telling when you're going to an insurance company and saying, hey, I need more money. I need a better rate, right? Like, you guys aren't paying me enough. And they'll say, well, what do you got to say for yourself, right?
Yeah.
And if you're not making improvements to your program on a continuous basis, backed by data, then you don't have the leverage that you need to have a meaningful conversation.
What happens if you have that data? What leverage do you have?
You stand out, right? In the same way that you stand out to a consumer, in the same way that you stand out to a family member, to go back to the value-based care contracting, right? Yeah. What is value-based care? Value-based care is legitimately being able to show that what you do works. they might not be ready to give you a quote unquote value-based care contract. But if you are operating in the confines of value-based services, right? If you are proving that what you do works, and it doesn't need to be perfectly, it's never going to be perfectly. But if you can understand first, if you can become aware, and then if you can prove what you're doing, how well you're doing it, and the efficacy of your treatment over hopefully a longer period of time, then you are in the gross minority, and you at that point in time have leverage to have a conversation like that.
Yeah. That's really, really fascinating. I guess I never knew how much leverage this would give you for these conversations. So I kind of want to switch gears and talk a little bit about how to do this without a big budget or without a team devoted to tech implementation. What are some ways that you might be able to start practicing measurement-based care today or next week or this month?
Yeah. It's a difficult thing to do, as we've talked about, without a software solution specifically designed to do it, right? It's a two-part thing, right? It's collecting the information and it's being able to use the information.
Yeah.
And what we've developed is a way to not only collect that information super, super easily, right? But a very, very visual representation of that data that makes it second nature to understand what that data is actually telling you.
Yeah.
Right. I would love to say that, without technology, why don't you start, first of all, just capturing some data. You could do that, right?
Yeah.
The whole point around this is to reduce the clinical workload.
Yeah.
My CEO is a clinician, right? What is and still has to be a primarily clinical tool has just now expanded into all the other things that we've talked about. It still eats and breathes in the clinical domain, right? Most of the outcomes tracking softwares in the market are going to be able to do more than what is currently available at somewhere that doesn't have anything, right?
Yeah.
But the difference being, it's changing, minds and behaviors. You know what I mean? It's the primary difficulty in any tech implementation and any change. Realistically, right? You change hearts, you change minds, you change behaviors, right?
Yeah.
But with the simple and pretty efficient implementation of a software technology, you can within 30 to 60 days kind of rewrite almost the approach that you have to data and using data within your business.
Yeah. I know ERP Health tracks a lot of different data points. It's a super comprehensive suite of data fields that you get to pull from. If someone isn't able to use something like ERP Health, are there certain data points that you think could be starters for telling powerful stories?
Yeah. I mean, listen, I think we all need to know general clinical symptomatic changes, right? We need to understand whether or not the treatment that we're doing is working, right? So we think about from a clinical viability perspective, PHQ-9, the GAD-7 for anxiety, completing treatment is a really important one for a lot of these facilities. Satisfaction, both at the experiential level and at the, client, clinician level. Understanding where patients are, whether it be with work, family, job, whatever it is. Understanding at least a core metric, a core set of metrics that are able to at least illustrate a story, patient by patient, where they started, hopefully you're tracking along the way, where they finished, having a system by which to continuously track, post-discharge gives you at the very least, a profile, if you will, that can be extremely powerful.
Yeah. Let's talk a little bit about ERP Health.
Sure.
To kind of wrap up our conversation. We'd love to know what ERP Health's approach is to measurement-based care.
Yeah, I mean, it's the foundation of the company, right? Eric Reminger, our CEO, started this from a deep desire to effectuate change by using data, right, to inform treatment. He tells a great story. He tells it better than I can about how in the beginning he was legitimately going from door to door in Philadelphia, knocking on treatment centers and saying, I want to come in and do this for you. And he would do it on pen and paper and legitimately go home, crunch the numbers, and come back with this, right? Luckily for all of us, he met a partner, Nick Barbuzos, who's our president, who brought the idea of making this a technology company into the company it is today. But at our core, the whole thing only really works. I think I just said this kind of right. The whole thing only really works if the clinical process is deeply embedded. The best use cases for us continue to be not necessarily the payer rate renegotiations, business development teams having, better referral relationships,
bonuses,
whatever it is,
bonuses, right?
Yeah. But instead, how many more patients are completing treatment because of this?
Yeah.
How many more patients are staying sober longer because of this?
Yeah.
How many patients are you able to engage with that you previously weren't? To see those stories is the whole basis of the organization.
Yeah.
The longer I've been in recovery, the more I've realized, right? Every single person's journey, whether it's in recovery or otherwise, really, is so freaking unique and deserves so much to be treated in a way that supports that uniqueness, deserves to be heard.
Yeah.
That if we can do that, again, in our small way, I think I'd speak for Eric, at least, when I say we would have done our job.
Yeah.
It's the backbone.
I'm glad we're ending with this, with the patient, because that's why the company got started. This podcast is really to help businesses be better so they can be better for the patients they serve.
Yep.
When ERP Health is involved with your clients, what is the feedback loop like? What are you having your clients do with your software to improve patient care week to week or every other week?
Yeah. So we have a customer success team that's actually comprised specifically of master's level clinicians. So again, it goes back to this whole thing. If clinical doesn't work, if the clinical part of this doesn't work, then it all doesn't work.
Yeah.
Because we have such robust reporting capabilities from within the system, we have weekly, if necessary, most of the times bi-weekly check-ins where we are, not only bringing updates to them about the capabilities that we have, right, but reviewing with them the summary of progress over that previous time. We constantly are imbuing, the latest, ideas from other customers that we have, right? We're building a community, really, an ecosystem, if you will, because only half the creativity comes from us, right? We get some of the best ideas from our customers who are, just using our technology and figuring out really cool ways to do it.
Yeah.
But we believe firmly, and we pursue ardently a partnership paradigm. There's the obvious, right? There's the way the technology works, and then there's the nuanced, and there's a number of different ways. I wish, my chief clinical officer, Dr. Corey McMahon, was here to answer this question more holistically, perhaps. But we stay, really tight to the hip with our customers.
And what's it like if I was a patient at one of these facilities that's using ERP Health? What am I going to see that's kind of different from someone who may not be using it?
I was just at a client in New Jersey last week, actually. And one of the features of our system to drive engagement, we've actually gamified the app, right?
So there's an app.
Yes, there is. And we actually provide tablets for an inpatient setting because they take away phones. Everything else done on the cell phone. And we've gamified the system, like I said, to drive engagement numbers up. And so specifically among young adult populations, what that basically means for us, at least, is that there's points associated with the assessments that you take. Now, one of the ways that we work with our partners is to design the framework for the program, the incentivization program, the rewards that patients would get, could get, will get once they accumulate a certain amount of points, right? And so in an inpatient setting, that might be, the first floor in that treatment center to accumulate 5,000 points based on the amount of assessments, might get a pizza party.
Yeah.
Outpatient or alumni setting, right? It might be swag, whatever it is, right?
Yeah.
But what always kind of cracks me up when I, visit clients and I talk to clients is that everybody's always talking about the points.
Mm-hmm.
That's just a quirky example.
Yeah.
What they're really experiencing on day to day is no pen and paper.
Yeah.
Right.
Surveys. It's different.
It's all tech enabled, right? It's on the tablet or it's on their phones.
Mm-hmm.
Not only that, it's quite literally the only user interface that I've seen that looks like something that we would use in 2025.
Yeah.
The simple
you and me, not speaking. It doesn't look like a clinician focused tool, although it enables their work.
Exactly.
Yeah.
Exactly. It's it has a social media look and feel almost, right? You build again the behavior into the mind. You have an incentivization through a point system, gamified the app, right?
Yeah.
You are getting the patient, that is, feedback from your clinician in the clinical setting with updates, feedback, guidance from the thing that you just filled out, earlier that day or earlier that week, right? And that, I would say, is the primary difference, right? You go to, 20 facilities. How many are listening to what I have to say and actually telling me something pertinent to what's going on in my own life?
Mm-hmm.
And obviously, I believe firmly that is by far the most powerful result that our technology ultimately enables with our partners.
Yeah. We were chatting before the show about that patient engagement, and I think I heard some pretty good numbers about adherence to the program.
Yeah.
Can you talk a little bit about that?
Yeah, I mean, within the facility itself, we have, portfolio-wide 85% adherence rates. We've pretty much made it our goal in life to make sure that we're doing everything from a clinical workflow optimization standpoint to make sure that there's nothing that's going to prevent a facility from not getting the data that they need in order to do all the things that we've already talked about in this conversation. Now, in our alumni engagement app, right, moving from inpatient to outpatient, still within the same part of that infrastructure, they step down and they become an alumni of the program. We designed an alumni engagement app. There's differing metrics on this, but we maintain industry-wide about 3% engagement with alumni once they leave our facility. That's 97% that are not within our immediate control or at least visibility into, right? Yeah. And so what we've done, and we continue to do as much as humanly possible is use our technology to continuously engage with those patients over a longer period of time.
Yeah.
To make sure that they know that they have some place to come.
Can you say it just again? How many folks are like part of alumni or stay in touch post engagement?
3%. And again, the numbers kind of vary on that, but generally speaking, that's a agreed upon number. Partners who have worked with us really closely to design the framework for their alumni program get upwards of 20 to 25% engagement after 90 days.
That's awesome.
And so just that difference, right? Recovery is ultimately, it's a spiritual journey for sure, but we won't get into that necessarily right now. But it's a personal journey. It is. And it's also a confusing journey, especially after what can oftentimes be years of abuse. And the only thing that I think we can do as an industry, really, is give as many tools and as much support in as many ways as we possibly can to help that individual get to that inflection point where they realize what they need to do, right? Where they realize what it is that needs to happen within them to make a sustainable change. All of the improvements, features, right? All of this stuff. It's all just fodder in order to provide a crutch for people for as long as they need it to get to that place where they can, sit quietly and in their heart know that, they're on their path now.
Yeah. Dillon, thank you so much.
Thanks for having me, man.
Yeah, it's
A
great.
lot of fun.